This is a paper on Paxlovid and the optimal timing for taking it in regards to COVID. In this paper, they used viral dynamics and electronic health records from 208 hospitalized patients in Hong Kong to fit a mathematical model to these. And by their estimates, Paxlovid can inhibit over 90% of viral replication. However, its effectiveness is critically dependent on the timing of treatment, where earlier treatment with Paxlovid significantly elevates the risk for viral rebound without further reducing infectiousness, and starting beyond 5 days reduces its efficacy in curbing peak viral shedding. Therefore, the optimal window for taking Paxlovid appears to be within 3 to 5 days after symptoms appear. The caveat being that this was based on 2022 data. However, from another study, we're showing that the peak viral load for COVID patients is peaking between days 3 and 5 after symptoms occur, which seems to be in line with the 3 to 5 days here. So that seems to be in agreement with what we were seeing before, meaning that you want to time the Paxlovid dose with around that peak viral load. So why is Paxlovid even important? Well, drugs that suppress viral replication not only improve patient outcomes, but may also reduce infectiousness to others. Once Paxlovid is started, the mathematical model projects precipitous drops in viral load within the first 24 hours of receiving Paxlovid. If Paxlovid treatment is initiated the day after symptoms appear, they estimate a 74% chance that viral rebound will occur, or that growth rebound will peak around about 10 days post-infection or post-onset of symptoms. And again, this is because the treatment of Paxlovid, the course treatment, is not long enough. The small window of 5 days does not cover the course of duration of disease, which means that not all virus is cleared over the course of treatment, which results in the rebound. It's nothing to do with the Paxlovid itself. This is what happens when you are not given a course duration that is long enough for the treatment needed, because the overall infection lasts about 11 to 12 days on average. However, for more delayed treatment schedules, the probability and magnitude of viral rebounds are lower. Patients who initiate treatment 3 or 5 days post onset of symptoms have an estimated 17% or 1% chance of a rebound, respectively. So that's 17% on day 3, 1% on day 5 when you initiate the treatment. Paxlovid is important to take for those that are eligible to do so, meaning they don't have contraindications, like they're not lactose intolerant, they're above a certain age, they're above a certain weight, etc. They don't take certain medications. All people that fit those requirements should be taking Paxlovid with a COVID infection. And that's because not only does it benefit the patient, but it also indirectly protects the household members and others who come in contact with them, especially if they're not masking or doing things like that. However, uptake in the US has been relatively low for Paxlovid, with only about 11% of COVID cases receiving antiviral prescriptions between the summer wave of 2022, between May and July. And the low uptake seems to stem from slow rollouts in some areas, complex eligibility requirements, testing, and potential drug interactions, which are certainly all barriers that need to be overcome in order to make sure that people that are eligible can get Paxlovid at a cost affordable and accessible way.